While governments grapple with the cost to the healthcare system and patients and families deal with the personal costs, medical researchers are trying to stem the tide of Alzheimer's cases by furthering our understanding of the disease. And Lawson researchers are on the front line with cutting-edge studies into mild cognitive impairment and how it could identify people at risk for Alzheimer's.
So can you please walk?
A short walk with potentially far-reaching implications. Dr. Montero Odasso is studying the gait of people with mild cognitive impairment. Walking and talking at the same time. It's something most of us take for granted, but it involves complex neural processes. And for people with mild cognitive impairment, it can be more difficult.
We found if you have subtle memory problems like mild cognitive impairment, or more important memory problems like a real dementia, Alzheimer's disease, your walking is more affected while talking.
In a clinical trial, subjects are asked to walk a short distance without thinking of anything in particular. Then they're asked to walk and given a task like counting to 100.
92, 91, 90, 89.
A computer records the changes in their gait. This is a computerized image of someone with mild cognitive impairment walking without given a task. Then they're given a task. The footprint becomes asymmetrical.
It's normal to have a little asymmetry or variability in their walking. Normal people or healthy older adults is 2%, but we found in people with memory problems or Alzheimer's is 10 or 15%.
It's research that holds the potential to one day be a simple test used by physicians.
In the future, we will expect that easy gait testing, walking while talking, may predict who is going to develop Alzheimer's disease in our elder population.
Lawson researcher Dr. Michael Borey is also studying mild cognitive impairment through diagnostic images that shows what's going on in the brain.
Well, what imaging is helping us do is to push back earlier into the disease and to make a more definite measurements about changes that are occurring at a very early part of the disease process.
The hope, the earlier we can diagnose cognitive impairment, the sooner we can intervene.
If we've got very early changes in the memory and we want to see if treatments are making a change to that underlying disease process, you've got to measure something other than memory loss because the memory loss is very mild.